go to my brother and I say, brother, I've been in Katrina, but my mean brother look at me, ball his fist up and swung at me. It's a good thing I ducked. Somehow I know I'm still able to carry on. Well, it's been a long time coming. I know a change is gonna come. Change gonna come. Oh, yes it is. Change is gonna come. Change has got to come to New Orleans. A change is gonna come. Change has got to come. I know a change is gonna come. Change, I know it's gonna come, baby. Well, a change gonna be here now. It's been a long time coming. But I know a change is gonna come.
All right. So good morning, good afternoon, and good evening, wherever you're calling from. Welcome to our first session in Organizing for Health series, People Powered Health. My name is Sachiko Usawa, and I'm the Membership Engagement and Community Practice Coordinator at the Leading Change Network, and I'm coming to you from Sweden. I'm kicking off this session with Pedja Stojicic from People Power Health, who is leading the series.
Welcome,
Before we jump right into the exciting stuff, I want to go over a few important things. So as you're joining, please introduce yourself in the chat with your name, pronouns, where you're from, and one word about what you do. Please also rename yourself with your first name and location. You can do that by clicking on your name on the lower left-hand corner of your video screen or opening the participants panel and choosing rename. If you go to the next slide.
Yeah.
Thank you. I would also like to make sure that everyone's comfortable with Zoom and the technology. So please make sure that you are on mute when you're not speaking so that there's no audio disturbances. We would love to see your faces, so please keep your video on if you can. And as you know, Zoom has a great chat function, so we encourage you to use the chat to share reflections, comments, questions, and resources with one another. This session will be recorded and the recording posted on our website for our members. We'll also be taking screenshots along the way to share on our website and social media later. So if you're not comfortable with appearing in them, please send me a private chat. If you have any tech issues, please put in the chat @tech or reach out to my colleague Mariana for support. So Mariana, if you can just say something in the chat so people will know who you are. All right. So next slide, please. Thank you. So this session is hosted by the Leading Change Network, or LCN, a global community of organizers, educators, and researchers. We develop and support new civic leadership that organizes community to build power and create change. And there are people all over the world creating change using the LCN pedagogy, which was developed by Marshall Gantz and his associates. But rather than working alone, we want our community to come together and learn from one another to organize more effectively. So the Leading Change Network is organized around 5 goals. First is to amplify stories for leadership and success. The second is to provide coaching for narrative and organizing challenges on the ground. Third is to create space for people to connect and collaborate with each other. Fourth is to foster a community of practice for people to learn with and learn from one another. And finally, to provide access to resources to practice and train the pedagogy. So what does this look like? So if you go to the next slide, we can see some pictures. So they can be learning events such as this one to share best practices and adaptation happening on the ground, or monthly online meetups to meet new members in the community, or resource center that has training and learning materials such as workshop guides, videos, and case studies, and skill practice sessions where you can get on the bike and practice together. If you go to the next slide. So we're most importantly a member-driven organization with over 350 members from 49 countries and over 6,000 subscribers. So if you're already trained in this pedagogy are not yet a member, we invite you to become one from our website. If you haven't been trained in the pedagogy yet, you can subscribe and we will share information about our upcoming orientation sessions for you to learn the framework. All right, so I'll pass it over to Pedja to talk about today's session and introduce the speakers.
Thank you, Sachiko, and welcome everybody. Good morning, good afternoon, good evening, depending on where you are. I know we have people all over the world, which is really exciting, especially in those LCN sessions. What I would invite you to do as well, if we love to see each other. I know Zoom is limited, but if you have capacity or you have ability to turn on your camera, just turn it on so we can see each other as well. In terms of the, my name is Pedja Stojicic, and I'm a long-term member of LCN and currently serve on the advisory board. But my personal passion has been health and organizing around health issues, both in Serbia, the country that I'm originally from, and now in the United States, where I currently live. I live in Boston, Massachusetts. But the purpose of today's session, and honestly, the series that we're planning around the next, within this year, is to, start to ask ourselves a question: how can organizing campaigns and efforts build power and develop capacity of communities to achieve equity and health justice? Not that we have an answer to it, but we want to invite you all into a conversation about it. And today you're going to see some of our friends and wonderful campaigns that they're doing. But as we go on in this series, like hopefully it will help all of us grapple with this question and trying to figure out the ideas, the emotions, and also kind of like the power that we can establish as a community. In terms of the agenda today, we will do. There will be a chance for us to introduce the campaigns, and we will hear in a second who is on our panel. Have a panel discussion about a couple of particular things. And then there will be a space for each of you to get into the breakout room and learn about each other as well, but also kind of like start discussing what is your experience with some of the challenges when it comes to organizing in the health space, and especially some of the challenges of building power in that space through the campaigns that we are all doing. So with that, I will, actually to diversify voices a little bit, I will invite my friends and colleagues who are going to be on our panel today to briefly introduce themselves by name and the place where they're calling from, but also like, why do they care about health justice? Like one thing to share why health justice is important for them, why building power is important for them from their perspective. So with that, I will start with my long-term friend and colleague, Steph Aines, and then Steph, you can pass it on to other panelists as well.
Sure, thanks, Pedja. Hi, everybody. It's good to see you all. My name is Stephanie Aines. I'm with the Right Care Alliance. I'm in the Boston, Massachusetts area. I'm involved in this fight for health justice because my mother was very sick when I was young. It wasn't just that she was sick, it was that we didn't have insurance, so she couldn't get a diagnosis. And once I realized that wasn't just luck, but that was like, there were systemic reasons why insurance was too expensive, that just got me so angry. And I still feel that anger, and that's why I'm here. And I'll pass it on to Jon.
Hi, everybody. Thanks, Steph. My name is Jon Shaffer. I am also in Boston, Massachusetts, so 3 Bostonians in a row. We'll move beyond that. But I am an organizer with Right to Health Action, a new campaign that you'll hear more about in a moment. But I got involved with health justice organizing first and foremost because of health issues that I experienced as a small child that I was fortunate to overcome. But really, it turned into political organizing as attempts to repeal the Affordable Care Act gathered steam. was involved in successfully fighting back on them. And I saw the power of people-powered organizing. I will pass it to my teammate, Allie.
Hi, everyone. I'm Allie Greenberg. I'm in New York City, so getting away from Boston. I got involved in health justice and health advocacy because I was actually sort of the traditional pre-med student and ended up doing some work abroad where I saw that people really didn't have sustainable access to medicines. Got involved with an organization called Universities Allied for Essential Medicines and started to really understand that our healthcare system is designed for profit and not for people, and that for someone who was interested in being a future physician seemed utterly unacceptable. And through the access to medicines work that I did, started to get connected with the larger Right to Health movement and joined Jon and Akshita in starting Right to Health Action. So I'll hand it over to Akshita.
Hi, everyone. My name is Akshita Siddula, and I am in Atlanta, Georgia currently. And I got involved with the fight to for health justice because I have always been interested in public health, and I knew that was the kind of community care was the work that I wanted to do. But it became pretty clear to me when I was younger that, as Steph said, that there are systemic reasons why some people aren't able to access quality, affordable care. And that just didn't sit well with me. And I could see that in my own community, in my own immigrant community. And that just kind of helped me double down on my commitment to this work and my passion for this work. So I'll pass it to Sreejani.
Hi everyone, I'm Sreejani and I'm joining from Mumbai, India. And I'm part of the Health Over Stigma campaign where we are trying to dismantle the shame and stigma around accessing sexual and reproductive healthcare services by young unmarried women in India. So why am I in this? Because I myself have faced, like a lot of discrimination, stigma and shame while accessing healthcare services, and especially sexual and reproductive healthcare services. And I know that there are so many women around me and like everywhere who go through this every day. And if I do not speak up today, then there will be, so many women who will continue to keep the silence. So yes, here I am trying to motivate other women to speak up and to bring change. Yes. Thank you, everyone. I'm really excited to be here.
Thanks, Sreejani. Welcome everybody. Just a few people who are gonna support this. You already met Sachiko, and we have Andy who is helping the timekeeping. She's not crazy. She's putting the time for all of us to see how much time we have in the sections. And then we have Mariana to help us with the technology and the breakout rooms and all of that we're going to do a little later. So once again, welcome everybody, and let's dive in. As a way of kind of like introducing all of this, just to acknowledge some of the frameworks, and this might not be anything new for the people who are part of the LCN network, but we wanted to kind of like level set the conversation by providing just what is our theory of change when we talk about organizing, and what some of the practices that LCN as a network has been practicing. And it's really important to acknowledge where is it coming from. So that's why I'm acknowledging our mentor, friend, and colleague, and inspiration, Professor Marshall Gantz from the Kennedy School, who used a lot of his experience in organizing to codify some of the organizing practices for this broader LCN community. So in terms of the theory of change, the idea here in organizing is always relatively simple. So we start with recruiting. We start with people. Like there's always a question: who are your people? And within that, like how we are recruiting and developing leadership. Then the next step is like how, around that leadership, how do we build power? Like how do we build, a community around the leadership in the communities that we serve? And then how to translate that power, that new set of relationships, because, in our theory of change, the power is relational into the change that we want. And in order to do that, there's a particular definition of leadership that many of you might be familiar, but I just want to kind of like remind us all, and for the new people, just to introduce it as well, that leadership is accepting responsibility for enabling others to achieve shared purpose in the face of uncertainty. And what is, I think, in this context important in this conversation is that the focus on enabling others and on a common shared purpose, which health in many cases is a really important segment of the way we are approaching and thinking about this work. But also, like, there's another concept that is important, and especially you will see that in the session today, that, you know, in community organizing, in campaigns and communities that sometimes, you know, have to build resources and build that power, that work usually happens in campaigns. And campaigns is a way, it's a kind of like a rhythm of change. It's the way to build capacity and power to achieve the purpose. And it's a different from a cyclical rhythm of organization, because it creates, it can create a momentum and build on that momentum to achieve some of the changes that we want. So that approach of campaigning is really, really, really critical one. But if you think about campaigns in general, what I want to offer as a framework, and you will see it in the conversation today, is that whenever you are analyzing any campaign, any organizing campaign or a social movement, you can ask yourself three questions. Like, what is the story of this movement? Like, what are the narratives that people are using? What are the narratives that, individual narratives that each of them are bringing into the conversation? And then what is the common or shared narrative? So there's that question, like, what is the story of the campaign? Then you can ask the question, what is the strategy? Like, how people together are collectively using their resources to turn them into the things that they need so to achieve the change that they want. So it's kind of like, if you look at a campaign, you can really start to see what is the strategy of this campaign? What is it that, how they are trying to achieve whatever change people need? And then the last thing is the structure, like what type of structure that is growing and developing leadership that campaign has created, so it doesn't depletes the resources, but actually build the resources over time. So that is the frame, that story, strategy, and structure that we're going to use in our discussion today. And I think you will be able to see, you know, how that can play out, and hopefully that will inspire you. If you haven't seen this before, that will inspire you to think about your campaigns or your efforts using that structure as well. So without further ado, I wanna invite our panelists to spend a little bit of time introducing the context. Oh, sorry, I forgot one thing. While doing this, there's an organizer journey. There are practices that we are doing, you know, like storytelling, relationship building, you know, strategizing together, building teams, or taking collective action that are also important for our journey in building the power. So with that, I will just invite Right to Health Action to briefly present their campaign and get us into their world and the context that they were dealing with. So later on, when we discuss some things, it will help us be grounded in what is the work that they've been doing.
Yeah, thanks, Pedja. Yeah. So hi, everyone. As I mentioned earlier, my name is Akshita, and I'm a part of Right to Health Action. And to give you a little bit of a sense of how we came to be, we kind of started very organically last March, right when the pandemic lockdown was starting here in the United States. And we came together as a group of friends and organizers, you know, activists in this Right to Health space, and people who've worked together before. And some of us were healthcare workers, some of us were public health professionals. And we came together during this moment of a global pandemic, and we were trying to make sense of what was happening. And we knew that our administration at the time was pretty much going to fail to have an appropriate response. We also knew, as seasoned public health professionals, that this pandemic was going to disproportionately affect communities of color. And we felt a lot of outrage and frustration at what was happening around us and to us. And we were looking for a way to take action, looking for a way to do something about it instead of just passively staying at home and witnessing a lot of, you know, preventable loss. And so in that moment, we kind of came together as this group of people who were looking to make change. And in the past year, we've grown into quite a large grassroots movement of tens of thousands of people from across the country. We're active in all 50 US states as well as the territories. And we're working together to make sure that this never happens again. So our focus, the change that we're trying to seek, is looking to ensure that the pandemics of the future are prevented, that this never happens again and people don't have to suffer through this process and lose people and lose their loved ones to a pandemic that could have been prevented. And this has been a very interesting and unique experience for us, coming together during a time of social distancing and trying to figure out how to organize and build community and build power, all virtually, all digitally. So many members of our team have never met in real life, but we speak almost daily through our work, which is just so interesting. And really coming together to create an opportunity, to provide people an opportunity to take action and have hope for change, especially when everything around us is so focused on crisis and despair and loss. And so in this past year, we've been able to achieve quite a lot. We have had several what we call web-ins, which is a teach-in and a webinar kind of fused together, a virtual teach-in, where we've been able to engage people in a lot of different fields in conversation around why this pandemic has happened in the first place, and how do we move on from here. We've been able to host trainings for the over 100,000 people that are in our community to get them equipped to have meetings with their members of Congress and to demand change. And the change that we're really fighting for, it comes down to what we call the People's Pandemic Prevention Plan. That's our comprehensive policy agenda. And it's, I think, unique in that it's quite cross-cutting. It cuts through the silos that exist in global health and environmental health and domestic health, and recognizes that in order to truly have an effect and have sustainable change that prevents future pandemics, we need to be working together and collaborating across these different silos. So our pandemic prevention plan is really focused on 4 big pillars. The first one being domestic public health core, so having a permanent public health workforce in the United States to build community resilience. We're also fighting for access to medicines and vaccines globally. So, understanding that just because we have the vaccine here in the United States, it doesn't mean that we're really protected unless everyone everywhere is protected. And then, of course, we recognize that to stop pandemics and to prevent this from happening again, we really need to make an investment in the global health systems of countries around the world that are, battling environmental degradation on their forefronts and working to stop these zoonotic outbreaks. We need to invest in those countries, invest in those communities, and provide them alternatives to, climate change and deforestation, in the hope of, not just catching the next outbreak, but preventing it. So that's our big policy agenda. And I'm so glad we're here to be able to share this with you guys.
Thanks, Akshita. That was great. Let's move on to our second campaign. And Steph, if you want to briefly introduce the Right Care Alliance and the campaign.
Sure. So the Right Care Alliance comes out of a think tank called the Lown Institute, which is in Brookline, Mass. And the Lown Institute is focused on research and writing about medical overuse and underuse. About 5 years ago, we said, well, writing and publishing isn't the only important theory of change. We want to have a grassroots wing fighting for the same things that we're researching. And that's where the Right Care Alliance was born. And so currently our community we bring together clinicians and patients to work together. And pretty much all of our members are people who have had some sort of trauma within the healthcare system, as patients, as clinicians, as family members, sometimes all of those. Our biggest hubs are in Massachusetts, Tennessee, Florida, and Maryland, but we also have people across the country. We have, I know there are some RCA members on this call who are from Pennsylvania and Minnesota. Ultimately, the change that we want in the world is a publicly run healthcare system, something that is not based on money and profits and greed, which we have a lot of in the United States. So we want a completely different healthcare system, and we choose campaigns one at a time that will help us get there. We've done a lot of work around fighting for affordable insulin and affordable drugs. Allie was actually a big part of that work and was on the leadership team of that work. And I'll talk more about the work that we're doing now in just a minute. With COVID times, our conditions are trying to bring together people from very different backgrounds. Clinicians and patients often have different class backgrounds, different life experiences, all the other identity differences. And so we work with that and trying to work with people across the country and trying to figure out how do we have national or local campaigns when we're all in so many different places.
Great, thanks, Steph. And then last but not the least, Sreejani, if you wanna introduce. Oh, sorry for that.
Yes, thanks, Pedja. So, like I said already, Health Over Stigma is basically a campaign where we are fighting for dismantling the shame and stigma around accessing sexual and reproductive healthcare services by young unmarried women. And when I say unmarried women, I mean any individual who identify themselves as women from different backgrounds, identities, and positions. So I'll quickly go to the people. So basically, we are a community of young unmarried women who have come together, and the campaign for us is basically a movement to challenge the stigma around accessing sexual healthcare services, and to create a solidarity network of women, doctors, and institutions who can take important decisions and bring change, so that together we can continue the conversation and convert the commitments into action and finally see change in the society. So some of the challenges that I could talk about is, of course, there's a lot of stigma around premarital sex, and also if you talk about your sexuality, sexual desires, expressions, and choices, and control over women's body and sexuality. And there is a huge gap between service providers and unmarried women, where the issue of sexual health and the stigma around is never considered a priority, and it's not a daily conversation. So even though we have doctors coming on board, even though women are talking about it, the gap still persists. And the change that we want to bring about is that service providers take the onus and accountability to provide provide a scenario and equitable access and stigma-free sexual health services, so that no woman has to ignore their health or go through any form of stigma while accessing their healthcare services. Yes, that's it. Oh, sorry, I also have to share the conditions. So the conditions that we are living in right now is, I'll just take 30 seconds. So like women deprioritizing their sexual health due to lack of conversation and safe space and neighborhood. And of course, like shifting accountability is always a problem because doctors do not consider sexual health as a priority. And yeah, like, of course, there is no conversation going on. And because of the COVID situation, like there's this entire, new challenge that has come up.
Yeah. Thanks, Sreejani.
Thank you.
That was great. And thanks everybody for providing the little bit of context in terms of the where we are. So we're going to start a panel discussion, and I want to invite all the people, this community that we have here, to react to some of the discussions that we're going to have in the chat by either kind of like providing your own experience or the questions that are emerging for you as we are talking. And hopefully, you can bring those questions into the breakout rooms afterwards, so we can, you can interact with other participants and have a conversation about them. So I want to kick us off by looking at the first, frame is about stories. And when it comes to stories, the conversation in healthcare is usually, it's really difficult because stories are really important for building the movement for health. But on the other side, some of the stories around health are really deeply personal. So, how do you manage that tension? And I want to invite Sreejani to briefly kind of like kick us off by sharing some of her experience and lessons from her campaign about that tension between leading with stories, but also, knowing that they are deeply personal for the communities and for the people who are doing this work.
Yeah, thanks, Pedja. Yeah, so, I'll directly jump into the conversation. So, stories are so important in our campaign because we started with stories. Like our campaign only started because, there was a woman who, had the courage to share her stigma story. And that opened a lot of avenues for us to reach out to more and more women and invite and welcome them to share their stories. So it's like, so basically the first year of the campaign was a lot about understanding the lived realities of women through story sharing. And it was a lot about, sharing circles where women met, and it was not just sharing our stories, but then also how we understood the collective identity of unmarried women going through similar emotions and going through similar challenges. So yeah, it formed a very important base for the campaign. And even today, we keep on encouraging women to, share their stories, because the moment we stop sharing, it's very difficult, like to get heard. So that is like one of the most important and focused area. But then like having said that, like of course, like there are challenges, right? Like that we faced a lot of challenges in the initial months of the campaign, because like sexual health and sexuality in itself is such a huge stigma. Like, like even if you just, like use the word sex, then it's like, oh my God, like what did people say? I mean, no, please, you cannot talk about sex. It's not a dinner table conversation here. Like it's not a conversation that also, like happens in important spaces. So to get the stories out from women, it was difficult. So there were, like reasons. Firstly, just because no one talked to them about it, the issue was completely deprioritized. So even though, and I remember like we asked some women to share their stories and they would be like, oh, I do not have a story. But then we do have our stories, right? But then the fact that we can club our emotions and experiences and articulate it in the form of a story that could bring change was a completely missing phenomenon, like for women. So that was a very big challenge. And apart from, the challenge that came from the community, another challenge was the politics of silence. And the silence was not just from the women, but then also from the service providers, like with whom we were working. So it was like, no, you cannot talk about it. You also couldn't talk about it in the doctor's clinics. You couldn't talk about it in webinars, in seminars. And whenever we tried challenging them, like, no, you have to hear us, there was, like this entire, there was a backlash. And there were things like, oh, it's a soft issue, or, women do not come to us. But then we also have to understand like why women are not sharing their stories, because most of the times they are not told to share their stories. Like most of the times they don't know that they have their stories, and which can serve as a very important, resource to bring change. So these were some of the challenges. And apart from that, what we realized was when we got together and when we started talking of our similar experiences, we knew that something has to be done, because our stories had power and we had the power to, bring change. And also the fact was that if nobody is telling our stories, we have to do it. So let's just, go out there and make it public and make ourselves more and more visibilized. So basically, why do we keep on stressing on these unmarried women? Because unmarried women as a community is completely invisibilized. So most of the times, we are considered as desexualized bodies, where no, you only have to wait for your marriage to, to explore your sexuality. Not that all married women can do that. There are different challenges there as well. But then at least it serves as a platform and a license to do it. So whenever, we come up with the stories, it's a problem. So there are some lessons as well that, we got and we understood. I think one of the most important lessons out of the stories was we could actually convert them into meaningful strategies. I'll give a very quick example. Like, for example, when we, started sharing our stories, we kept on focusing on it. No, the service providers should do something. No, the owners had to be shifted. So we knew that, okay, so this is the sentence that's important here. The onus, the accountability has to be shifted. And they have to, take the responsibility of providing us with stigma-free services and justice. Because of course, this is my right and you have to, provide me with that. So how, I think if you keep on telling your stories, you could also find your strategies out of them. So it was one of the most important lessons that we, got. Apart from that, stories bring you together, your collective identity is reiterated again and again if you share your stories. So so these are some of the experiences. And
great, Jon. Yeah. Thank you for putting it. I just want to invite other panelists to reflect on this and kind of from their experience. What did they see? What how stories were emerging in their campaigns, or what importance did they have?
Yeah, I can speak a bit about Right to Health. I think we started at a very emotional and difficult time, and we realized that a lot of people were being impacted very personally and directly by the pandemic. And we were called to action to do something about that, very much in the same way with the fight to save the ACA, focusing on the policies that we needed to prevent this from happening again, and also ensure that we put an end to what we were seeing happening right now. and we felt a little bit concerned about reaching out at a time when people were really dealing with trauma, and in the thick of that trauma, and asking them to take action for us. You know, we wanted to respect their need to have privacy and deal with their grief. And eventually we did realize, you know, with this type of work, stories are so essential. They make things personal, and that is what you need to be doing when you're fighting for policies. And so we decided to start to slowly think about how to engage and seek out these stories in a very, you know, passive way, so that people could come to us who are comfortable sharing. Starting with just an online forum, but then connecting with different partners to find ways to really personally connect with people and find ways to empower them to share their stories. And particularly, we ended up working with someone, Sarah Atkins, who had a really powerful story of losing her father to COVID-19, and recognizing that she felt that she needed to be doing something, that just sitting in that grief was, you know, so painful and so frustrating, and she was so angry. And the way that she tells her story of joining us and feeling that call to take action has really inspired us and helped us to think about how we bring other people into our work. I think so many people, especially during COVID, where we're so isolated, you know, we can't have funerals or memorials. They want a sense of community and a sense of purpose. And so we've tried to start framing our work in that way when we seek out stories and share those stories as, you know, a call to action and a way to mobilize.
That's great, Ali. I just want to comment on one thing. I'm curious, like from Steph and John and Akshita, like, you know, it seems like there's a lot of kind of like individual stories coming into a space. I'm just curious, like, what was your experience in creating collective stories out of those individual stories, especially for health? That could be one of the issues.
Yeah, I mean, just real quick on that. I mean, I think seeing the courage and the hope kind of inherent in people sharing deeply vulnerable and deeply personal stories, I think gave me and our whole team a great deal of courage to kind of work together and to see why this work was so important. I see that Kim Fenice is actually on the call today, and she's somebody who is on our team and shared, you know, a really, really challenging story from her own experience very publicly. And I know that, like, our whole team, you know, after that had a lot more energy and courage to continue to drive the work. So yeah, that's one way I think that, you know, these personal stories can start to cultivate and be turned into stories of us, right, that motivate the group more broadly.
That's great. Steph, it seems like you wanted to say something.
Yeah, thanks. No, I resonate with this so much. We've had times when we've had folks who talk about losing family members because they couldn't afford their healthcare or coming close to death themselves. Those have been some of the moments when we've come together most collectively and have been able to then build a story of us and choose some campaigns, especially around our insulin work. One of the other challenges that we have in this, I think, is for our members, there's both, and probably for so many of us, there's the personal story of why healthcare, but then the story of why organizing, why leadership, those are not always the same story. And so how do we make the time and space to go over both of those stories and bring them together?
That's great. Well, I hope we can explore that in the breakout rooms. And I want to, Sachiko, is there something that is emerging in chat? And because I want to shift us towards the strategy conversation as well.
Yeah, so I think Sharon shared a little bit around the challenges of how to, I guess, make sure the focus is on action, especially since stories around including like losing a loved ones could be or medical malpractice is really one of like harm and suffering. So how to set up a space for that, but also to make sure that the focus is on action, I think, and that could be something that could be pursued later on in the breakout rooms.
That's great. It's good. Where do we find agency in some of those stories to move forward? I think in that respect, I'm going to shift us towards the conversation about strategy. And what is interesting in health, like, you know, you have a lot of those, you know, injustices that are happening kind of like all the time. You see them as patterns, as repeated patterns, but at the same time, like the needs of communities are constantly changing. And I think the COVID-19 pandemic was an example of that all of a sudden, everything was, somewhat focused on that, but you can see the same injustices emerging within that pandemic. So one question in strategy is like, how do you pivot? How do you change, as an organization, as a campaign, how do you change your priorities depending on the emerging context? So I will invite Steph to reflect a little bit, to open up the conversation about it, because I know they had some experiences and lessons about that particular topic.
This has been a real challenge and a real ongoing questioning with the Right Care Alliance. We started 2020 planning a campaign around fighting medical debt. And that was going to involve a lot of in-person, literally showing up in hospital billing offices. So once COVID started, that wasn't going to work anymore, even though we knew that this problem would be, was not going to go away. And a real challenge we faced over the past year is we've had so many calls and meetings where we get together and say, okay, this is the situation. So let's make a plan. Let's make a campaign around masks, COVID tests, vaccines, whatever. And then a week or two later, something would happen in the federal government or our states or our cities. And then we would say, oh, actually, tests are going to be free for everybody. Oh, wait, no, nobody can. Tests are going to be $200 per person. And it was so dizzying. Okay, I'm seeing nods. That's making me feel better already and less alone in this. It's been such a challenge to be on these calls, and it feels like everything is changing all the time. And so how do we make a plan? Where I'm starting to come out of this now is that, yes, things have changed, but also they haven't. We started the year 2020. We started the COVID pandemic knowing that healthcare in the United States is a business, that healthcare is about profits. It is not about keeping people healthy. That has not changed. Every single issue that we've talked through, tests, masks, vaccines, insurance, housing, whatever, that has remained the same. And so where we are now is organizing for accessible vaccines, both that they're reliable, fast, equitable, and easy for everybody to get to. The people with the highest priority need them. We've been pretty consistent in that even over the last few months as vaccines have been rolling out across the states, doesn't necessarily mean that people actually have access to them. And I think the biggest this is both a takeaway, but also an ongoing question for me. It's the same thing as how to hold true to something that isn't changing, but also while it feels like everything is changing. Is all of this just the chaos of the American government over the past 400 years? Is it actually true that these things are changing? How do we navigate that?
That's great. Well, thanks for that, Steph, and thanks for vulnerability around that, because I think we feel the tension all the time. Any comments or reactions from other people? Like, how does this resonate with you? And how difficult or not? And what are your strategies when you need to pivot, like in the campaigns?
Maybe I can just jump in real quick from R2H. I mean, since we're doing essentially legislative action, I mean, our strategy hinges on trying to pass law. I mean, everything that Steph said resonates so deeply because it is chaotic and it's also technically complicated. Like, if your goal is to push members of Congress to, move forward a particular legislative language in committees, and you're trying to get trying to work with constituents of a particular member of Congress to push them to do that, but the context in Capitol Hill is shifting all the time. How do you quickly help sort of technical information get to where it needs to within our organizing structure? And this will feed into the structure conversation that I hope to have here in a moment, but it's a real challenge because it is moving so quickly. There's a lot to know, but also we want our teams to have kind of the creative agency strategically, right, to come up with new tactics themselves. So I don't have a good solution to this either. I think we're wrestling with it. Hopefully someone in the audience can help us figure it out.
Yeah, that's cool. Any other comments from
Sreejani? I can add something, if that's okay. So, I think one of the major challenges with strategy is that it keeps on changing. I mean, it keeps on changing with your social, cultural, and external reasons as well. So the thing that happened with COVID. So initially, our plan was to win the campaign by June 2020. But then, with the entire pandemic situation that happened, we had to change the entire strategy. Like we had to go back to our community, had to understand like what is it that they need right now. Maybe they do not want to work right now. So it's also time for us to pause and reflect and then, like re-strategize. So I think this is one of the challenges that we have faced. Like we know the strategies change, but then my question is also like how many times we can, like keep on changing our strategies, and how like easy or difficult it is for our community to adapt to that change in the strategy, and how effective it could be.
Yeah, no, that's a great question, because that goes back to the, if you're building power, it can feel really disorienting, like when people are or the campaigns are constantly shifting, but at the same time, if you're not shifting, that it becomes the, you're not responsive to the realities of the people. So maybe an answer, like, we can shift a little bit towards the structure, like, and I know, John, you had you had a reflection on how you were building a structure, because the structure could hold things together even if strategies are shifting. And then what are the challenges of doing that, and especially in this online offline space, which becomes like really weird really fast.
Yeah, I mean, would you be okay sharing that slide that I?
Oh, yeah,
had?
sure. Yeah, I will try.
Yeah, thanks.
Yeah,
yeah, no, I think that basically so as Akshita shared at the beginning, we emerged in a time of all digital organizing and had no kind of in-person organizing space. And so we're forced to kind of find and build our constituency via online tools, right? Which allows you to kind of grow very quickly, right? You can develop online petitions, online letter writing tools in which you can reach massive audience, which we did very quickly. I mean, hundreds of thousands of people took action with us, via Action Network and these things, and partially was the moment, right? Everyone was afraid of COVID. Everyone was. But, we all know the sort of downsides of that kind of large scale sorts of kind of online recruitment. It's usually pretty shallow, right? And an article that Pedja shared with me that I resonated with deeply is this article by Theda Skocpol, Resistance Disconnect, which was in a recent issue of the American Prospect. But it tells a story, kind of a cautionary tale of some of the challenges that Indivisible has faced in kind of holding together a national organizing structure with shared strategy. And I think it's something that we've, frankly, wrestled with a bit. And so what we have tried to do, and I think have had some successes and some challenges, we have tried to recruit basically from this huge online pool of people who have taken action with us, who have digitally raised their hand and said, yes, I want to participate in a campaign to end pandemics, to basically take on roles and responsibility for leading and developing state level teams. But I think what we've realized is we've done too little to train them and enable them with the tools that they need to be successful in that role. And so there's been, pretty significant unevenness in the ability for those state level leaders to really build real teams, right? And so, and I think our leadership team takes full responsibility for not doing enough to enable those people to really step into those roles. I think that there is real interest and desire, real stories, real motivation to take that on. But I think we need to be doing far more to help develop the skills and capacities for them to be able to do that. And I think one of the biggest worries that I have going forward is sort of, maybe this is too much, but like some kind of a bubbling skepticism that even real teams are possible, and sort of what we can do is continue to do more online actions, more online collectivisms. If we just get another 100,000 people on the list, then we could get 100 people to the event, rather than really helping people step into real roles, develop real teams, and do the real organizing work. And so those are some of the tensions that I feel around our structure. I think there's an opportunity to do it, but we need to figure out how to invest seriously in the training and commitment of our core leaders?
No, that's a great question, and I want to invite Steph to comment on this because I know she was particularly interested, and she's been building chapters like of Right Care Alliance and the campaign for a while. So any comments or reflections on this, Steph?
Yeah, full disclosure, I was just paying attention to chat for the last 30 seconds, so I probably missed some of the last things you said, John, and I'm really sorry. But overall, this tension absolutely resonates. The idea of like, how do we keep teams flowy and structured? I feel like I've worked with so many like budding organizers who will say things like, no, but having a structure is white supremacy. I am against having any structure. And that just kind of puts me at a loss, where I think there's so much to unpack about white supremacy and racism, but I also believe that, just like you were saying, like having structure is what allows us to do all of this work. And I think besides that, I've encountered so much fear around when we build a commitment, that means like we all have real commitments, and that's hard and that's scary and it takes a lot of time. Yeah. And so that's been a real challenge.
Yeah, no, that's really, really interesting. So Johnny, I'm noticing that you're on the edge of jumping in. And I was curious about how did you it seems like you built some teams like intentionally, and I'm wondering what enabled that and what enabled the leadership development piece of it.
No, I completely resonate with Steph, the fact that there is a fear like among people, and also the fact that the question on structure. I mean, what is the definition of structure? No, we do not want a structure. Like, I don't want to, be in this. So yeah, of course, like this is so true. And it also becomes so difficult for us to, get commitment. So of course, like in our campaign, we have 2 layers of leadership teams, right? And also, we are like, oh, wow, we have so many people working with us. It's a great thing. But then the reality is that it is still very isolated. I think the most important challenge, of a particular team structure is that it's good that you have a structure, but then how is it growing? I mean, how are you building their capacities? I mean, are they, at times I also ask myself, like, are they even, understanding the urgency of the situation? Like, are they even excited to, build their capacity? And how do I, keep on generating motivation, keep on, harnessing this spirit of commitment and, accountability. So yeah.
That's really interesting. I think, I know we brought a lot of questions to all of you, and this was a kind of like, but you can see like those are the real challenges that campaigns are facing with, and especially when it comes to organizing around health. And so that's why this kind of like nobody have a quick fix solution to how do you build community power, because it takes time, it takes effort, and it takes like really asking some of the deep questions, like and challenging your own leadership in that context. And I hope that we model a little bit of that. But before, Sachiko, I will ask you about the chat, and then also invite you to introduce our breakout rooms, because right now we want to shift gears from us talking to actually facilitate a little bit of discussion among everybody who's on the call. How to address some of those challenges around story, strategy, and structure. So, Sachiko, the reflection from the chat, and then introducing the breakout rooms.
Yeah, so I think the chat is becoming more and more active. I think in terms of the structure piece that we just discussed, some people were mentioning the piece around tyranny of structurelessness, and how it is, I guess, kind of misconception around structure, but the importance of it to actually to build capacity and for campaigns to move forward. I think another point that was being mentioned in the chat was around this thought around how to get people to acknowledge that health is political, and also the culture of the health patient profession relationships, and how the campaigns that we were discussing is actually challenging around about how do we challenge that predominant culture in which there's the patient, it's not patient-centered, or health is not considered political. So those were some of the things that was coming up in the chat that I think also would be interesting to explore in the breakout rooms.
That's great.
Yep, which take us to the next part, which is the breakout room. So Pedja, if you could just quickly change slides to
Sure.
The next part. Great, thank you. So I know that many of us in the room are working to lead change in our own communities, whether that's in the field of health or otherwise. So now we want to hear from you on the questions, challenges, and the best practices that you've been seeing in your campaigns or in your work, prompted by this panel discussion that we've just heard. So we'll be going into breakout rooms for small group discussions. And what we'll do is that we'll have 5 breakout rooms, each led by a panelist. So the panelists will become facilitators this time, not panelists, but facilitators, to help you reflect and share the questions and challenges that you have. And how we're going to do is that when we open the rooms, you'll be able to choose your own room. I think people joining from mobile may not be able to do that. So if you can rename yourself with your just add like strategy or structure or story, whichever topic that you're interested in, at the end of your name, then Mariana will make sure to assign you to that room. But so each of the rooms will take on one of the themes that the panel discussion was organized around. So story or narrative, strategy, and structure. And so I've listed here the rooms and the facilitators. So Sreejani and Ali will be leading rooms focused on story, Steph on strategy, and Jon and Akshita on structures. So if you could choose one of these rooms that you would like to join and participate in the small discussions. And once you go into the rooms, you'll have 15 minutes. But what I would like to ask everyone to do first is to initially start off by individually reflecting in the chat 1 or 2 challenges or questions from the panel discussions that's related to the theme of the breakout that you chose. And then the facilitators will lead a discussion around 1 or 2 common or main challenges or ideas to deep dive in and have a deeper conversation around. And to wrap up the 15 minutes, they'll ask you again to reflect individually in the chat some of the key takeaways and learnings from the discussion. And I also want to highlight again that this space is for you to bring your questions and challenges and share them. So the role of the facilitators is to facilitate the conversation and guide it and help you hold the space. And once we come back to the main room, Pedja will be asking each of the rooms, the facilitators from each of the rooms, to share what was discussed in each room. All right. So if that is clear for everyone, I'm going to ask Mariana to open the rooms now. Great. And let me know if anyone is having trouble joining the room. Otherwise, there should be a bar at the bottom that says breakout rooms, and you should be able to click on that and choose a room.
Welcome back. It's good to see everyone. I can see the videos are on, which means that you turn them on in the small groups, which is great. I want to invite everybody to, to take a minute and write down in the chat, like what are your takeaways from the conversation, and what are the things that really stood out for you from the conversation that you just had, and then put them in the chat, and then we will invite facilitators to reflect on that as well. So Andy, if we can take a minute for everyone to write things in the chat and then share it, and then we will take it from there. Let's see, commonality of obstacles. Deciding how to decide with grassroots organizing required upfront work, but it's important. Judith, do you want to speak a little bit about your takeaway, just to voice it as other people are putting in the chat?
Sure. Yeah. I was on with Ashley and Akshita, and Ashley and I both work with and support like newish and health organizations, and we were just talking about how we've all sort of used this curriculum in other sort of spheres of social justice or politics, and that it feels like it's relatively new in the health justice space, although I'm sure some of Marshall's people from all over the world have used this in health justice, but I just wasn't aware of it. And so it feels like there's a real opportunity to do some like training with groups and organizers in the health equity space on the story, structure, strategy, action curriculum.
That's great. Well, thanks, Judith. I think there are some opportunities within the LCN as well to do that. I know Sachiko and Mice will talk about that a little later. Marie, like, do you wanna kind of like comment on the issues that it seems like there are a lot of commonalities, but like what were some of the things that you emerged for you?
I think what emerged for me, thank you, Pedja, is people were thinking very, very similarly. Not quite coming to answers, but we thought it was important to involve young people because they are the future. So let's get them thinking about this, but also the conflicts that people felt really around not being able to do what they wanted to do. So seeing the issue, but conflicted even within their own profession is what we heard. There's something too about, how do we expose professionals, politicians to the lived experience and to hearing stories so that they in themselves can be changed and moved. So we were conflicted. We were identifying challenges, as you said.
That's really interesting because you reminded and said at the beginning that this is going to be the series of the conversations. Like, and one of the topics that we were exploring is like, how do we expose healers and caregivers and healthcare professionals to both skills but also the experiences. So I think it's a really interesting, and Sreejani was talking about that as well in the context of their campaign. So let's hear from the panelists, well, in this case, facilitators. What stood out for you? Like, what were the things that in your group were kind of like interesting and something that you wanted to reflect on? And let's start with Akshita, if you want to go first.
Yeah, I had a great conversation with Ashley and Judith in our breakout room. And I think one of the things we talked about was how it's not very common yet to use this kind of organizing language and structure and approach that's very common in political organizing work, but not as common in health advocacy movements, and how those are so central and needed in order to be successful and effective. So we were talking about how we're so happy to see health advocacy campaigns kind of using this pedagogy. But then we did talk about, as Judith mentioned, there's a great need, across all of our 3 different organizations and the work that each of us does, which is so different, but the need is the same, that we have so many wonderful organizers, people in our community that want to do this work, but need the training in order to do it well. And how do we invest in our teams, our organization's capacity to do this work so that we're all on the same page, we're all up to speed. And what does that look like, right? There's a lot of resources here with LCN, but how do we get those resources and that knowledge into the hands and the heads of our organizers in our team? And that was a big topic for us.
Well, a great one, and that definitely a challenge for LCN to do more of that work, and for all of us to actually create that, because we are part of the LCN as well. So let's see, Steph, do you want to next?
Yeah, sure. I was in Mari's group and she summarized it very well, that we raised a lot of questions, got into a few examples, but we really were all asking these questions about how we build community and politicize people across all of our different groups of clinicians, patients, or community members, and government. And what I think is really interesting is that we were the strategy group, and yet what we talked about kind of came back to storytelling and building relationships, that in order to build our strategy, we have to build our relationships in our community.
I'm particularly interested if other people in that group, like when you say politicize, like how would you, especially in the healthcare space, I know that there's a push like, depoliticizing things, like, especially among healthcare professionals, like you don't want to get into politics, but like politicizing is the opposite of that. So Any reflections and comments on that from Steph, your group, or yourself as well?
I mean, if we have time, I would love to open that up to folks in the group.
I mean, I think I can summarize a little bit, at least where I'm coming from, and I mean, I can speak as a physician. It is imbued in my and I'm not very far out of my training. I'm like 10 years out of medical school, and it was and I went to a relatively progressive medical school, but we are not supposed to be political, and yet health is political. Nothing that happens to my patients, not a single thing that happens to my patients, is not impacted by the politics of what's going on, and that is not how we're trained to see things, and that's really, really hugely problematic. And I don't have, the answers at all. I'm looking for them, but I can say, as somebody who feels like I'm sort of on the inside and sort of on the outside, that's the framework, I think, from where many, many people are coming. And I think it's changing, but it's not changing fast enough.
That's right. Yeah. Well, maybe we can accelerate that change a little bit in the work that we do. So Johnny, do you wanna reflect on your, thanks Amanda for that. What do you reflect on your group?
Yeah, thanks, but I think Ali and I was in the same group, and Ali, I would pass it on to Ali.
Oh, that's great.
Yeah, I'm actually, there's some stuff that we talked about that I think directly relates to what you just shared. We started with discussing the challenges of taking something that's so complex, healthcare and health policy, and not working from this very top-down approach of how we approach, our advocacy, really respecting that everyone has a story in relation to healthcare, and that we're frankly not doing a good enough job of getting people to feel comfortable or creating space for people to share those stories in an honest way as well, right? I'm currently a medical student, and we were discussing how, the main ways that we elicit feedback or information about people's experiences is through these very impersonal surveys, or maybe at the end of our visit, a quick, how are things? Do you have any questions? But we're not taking the time to really encourage feedback in an honest way. And one thing that we talked about that could maybe be a step towards improving that is really trying to be role models ourselves, both in Right to Health Action, as well as Right Care Alliance. And it sounds like in Sreejani's work, there are a lot of people who are providers and who also have their own stories. And so starting to share our stories to normalize that kind of conversation, help people see the power and the opportunity and having that space to share your stories, to rework them and practice them and turn them into a tool rather than just something, that you share and move on from. It's not totally clear how to do that, but that could be a step in the right direction.
That's great. I just, my personal reflection, there's also kind of like that permission for healers and caregivers to lead with stories. Like I've been doing recently the work with immunization professionals in Africa, and it was fascinating. You have the kind of like they're fighting the narratives of anti-vaccines, like the anti-vaccination narratives, and they're not trained to use the narratives. They are trained to use the technical language, and you cannot, as we all know, like you cannot fight the narrative with technical language and facts. You need to provide an alternative narrative. So it's really like giving the permission to people to lead from that space could be really, really critical. So last but not the least, I know, Andy is gonna push us a little bit. John, what was the structural kind of like conversation and stories about structure?
Yeah, just quickly, I mean, Kenneth led us off with an important challenge, real life challenge that he's faced. Basically, being a part of a grassroots organization and trying to essentially propose a new tactic, a petition, and facing sort of a bit of a quandary about how to decide as a coalition, how to take that tactic forward strategically. So this for us raised, the important question of, how do grassroots groups that aim to be democratic and participatory make decisions together? And so we went into a conversation about the classic decision-making norms. How do we facilitate early on the process of deciding how we decide, at what levels different kinds of decisions need to be made, how revisions are made in real time. But we also acknowledge that this is really hard, especially when things are pivoting on a dime. Things are changing very quickly. The world's shifting around us, and that this is a fundamental challenge that we've faced with Right to Health Action. We also talked a little bit about the utility of tools like before action reviews and after action reviews, which can help teams sort of unearth maybe unspoken assumptions about how things go, and that could be a tool that we all lean on, as well as external coaching, being able to have people who aren't in the thick of it, who have maybe vested interest in certain decisions, be able to provide guidance and questioning and help teams sort of get past challenges. So, but those are some of the things, and thanks, Kenneth, for bringing that challenge to us.
That's great. Yeah, and kind of like, especially when it comes to collective decision making, it becomes like but on the other side, like if the structures that we are trying to challenge or dismantle are, if we don't provide alternative structures to that, then it becomes like just a replica of the of the system. I've been talking about that with in the context of healthcare, especially, like there's a long history of hierarchical structure in medicine, like for example, and challenging that requires like providing an alternative to that. And you don't get that in any school, actually. Like the most of the teaching on teams is not teaching interdependence and leadership in the context of the social movements. It's teaching the corporate type of structural, this is how you run the team and you're at the center of it. So, okay, this is great. I hope you had some fun talking about those things. I just want to remind people that this is the beginning. So we're going to use some of the insights from this and also the chat to actually maybe craft even more deeper and targeted conversations about some of the challenges that we just raised. Since this is the first one, I want to invite everybody to give us some feedback. Like in the chat, there'll be an official evaluation and that will go out. But in the chat, if you can do like what worked for you, what facilitated, kind of your learning today, what were the pluses, and then what are the deltas? What can we improve next time, to facilitate more of your engagement and learning in this space, because we want to learn and grow and develop this as a series. So if people can, we will really appreciate to hear that and put it in a chat, like pluses and deltas. And then with that, we don't have a date for the next session, but I can promise you that there will be one, and there will be a couple of them actually this year. But there are also other activities that are happening within the LCN. And I will invite Sachiko or Mais to give us a little bit of overview what's coming next within the LCN.
Thanks so much, Pedja, and thanks everyone for sharing. So just as people are writing their pluses and deltas in the chat, I would like to announce what's coming up at LCN, what you can look forward to. So our next event is on April 21st, where we'll be joined by Liz McKenna, who will share groundbreaking research from her new book called Prisms of the People. So where Liz and her co-authors use data from movement organizations across the US to explore how movements successfully built the constituency base and translated that into political power, and what kind of organizational choices enabled this. So that's definitely one event that you can, I'm hoping to see everyone at. We also have our monthly meeting Connect on April 28th. For people to be able to connect with and meet organizers and leaders around the world. And in May, we will be starting with our Organizations Learn series, a space focused on specific challenges and best practices faced by organizations that are practicing and training the pedagogy. And our first session will feature community organizing in Japan. And if today's session sparked your interest in learning more about our organizing pedagogy, or as I've heard from many of you, if you already know the framework but are struggling to get your members or your campaign members onto the same page and to speak the same language, then our orientation to organizing session on April 14th is actually a really perfect opportunity, because we're going to provide a kind of a crash course introduction into the framework. And again, if you're not yet a member or subscriber, we invite you to join LCN as one. And I think Mariana also shared the relevant links in the chat right now.
And Sachiko, if I may invite everybody to unmute themselves and just to give a round of applause for our panelists, like for all of you who participated. And thank you, John, thank you, Ali, thank you, Steph, and Akshita and Sreejani. Thanks for participating in all this.
Thank you, everyone. Thank you, Pedja, for leading this, and thank you, everyone, for joining today.
Looking forward to
Alright.
seeing you soon.
Have a great weekend, everyone.
Thanks for organizing. Thanks for
Bye.
having us.
Take care.
Thank you.
Thank you.
Thank you all.